Hello everyone, if you're watching this video, chances are you or someone that you know is suffering from foot pain or deformities like bunions and hammertoes. You may have been told by your surgeons that surgery is necessary to fix the problem, but like many people, you have been avoiding it for months and years, living with the pain and suffering because you've heard horror stories about the foot surgery from your families and friends, how terrible the recovery process be and how painful it was. So then stay tuned because I may have a solution for you. Hello everyone, I'm Dr. Dean Kim, your local foot and ankle specialist here in Frisco, Texas. In today's video, I'm going to discuss the benefits of MIS foot surgery compared to a traditional open surgery and tell you how it might help solve your foot and ankle problem. Now let's talk about traditional open surgery, and for the purpose of this discussion, let's use a bunion surgery as an example. Bunion surgery is one of the most common surgeries that are performed in my office and by other foot and ankle specialists, but it is often associated with long and painful recovery process. So in traditional open surgery for bunions, the first step is to make skin incision by your surgeon that is usually between 4 to 8 centimeters long. Once the incision is made, a surgeon needs to cut through different layers of soft tissues to each area that needs to be fixed, which in this case is the bone, the bunion. Now at this point, your soft tissue in your foot are already under a lot of stress just by making these cuts and incisions. And also they're under put even more stress during the surgery because these soft tissues needs to be retracted in order for your surgeons to work on the bones or fix the bunions. With this pressure and stress to your soft tissue, which includes your blood vessels and your nerves, this can cause prolonged swelling, pain, scarring, and even longer recovery period. Now, depending on the type of the procedure, you're looking at about 4 to 12 weeks of non-weight bearing, meaning no walking, and then also you may actually need more physical therapy after this period is over. Now, this is significant amount of time spent recovering, and not being able to walk for 3 months can be very difficult to many patients. So now let's talk about minimally invasive foot surgery, or in short MIS, and how this could benefit you and help solve your foot and ankle problems. So in MIS, we use a specialized instruments and techniques to make smaller incisions that are about the size of your pinhole, and we perform surgeries with more precision. Now there are many foot and ankle pathologies that we could fix utilizing this MIS technique, but again, for the purpose of this video, I'm gonna focus on the bunions. So with MIS, to fix bunions, I typically use 2 small incisions, sometimes 3, depending on the severity of your bunion and depending on what we need to fix. And each of these incisions are actually just few millimeters each. And using a specialized surgical equipment, everything is fixed under these small microscopic portals without violating much of your soft tissue integrity. So with minimally invasive foot surgery, you can expect the following benefits. So number 1, less swelling, less pain, and less discomfort. So smaller incision means less tissue disruption, which leads to less pain and less swelling during and after the surgery. In fact, most of my patients don't even need narcotics to manage their post-op pain. Most of my patients take ibuprofen and they're off of it within a week for pain management. Now number 2, let's talk about faster recovery time. Since there was a minimal tissue disruption, your body can recover a lot quicker, allowing you to return to your normal activity a lot sooner. Most of my patients after bunion surgery with MIS is walking right away in a specialized surgical shoe or a boot, and they're back to a normal shoes within 4 to 6 weeks. Another benefit is less scarring or minimal scarring. Since the incision is just about few millimeters, there's minimal scarring after the surgery, and it's cosmetically very pleasing looking after the surgery. So lastly, with this MIS, there's lower risk of complications. Again, the smaller incision and less tissue disruption of minimally invasive foot surgery can reduce the risk of complications such as infection, bleeding, and nerve damage. So that being said, it is important to note that not all foot conditions or patients are suitable for minimally invasive foot surgery. So let us evaluate your individual circumstances and medical history to determine if this is the right approach for you. Again, in summary, minimally invasive foot surgery offers several benefits over traditional surgery, such as less scarring, reduced pain and discomfort, faster recovery time, low risk of complications, and improved accuracy. If you have any questions about this approach or any foot conditions, don't hesitate to call our office for a consultation. Thanks for watching this video, and don't forget to subscribe to our channel for more foot and ankle related tips and information. Now, thank you and have a great day.